Ladies, listen closely, because what I'm about to share with you is something I wish every older woman over 60 understood. It's about your health, your happiness, and yes, your relationship with your own body. You see, too many women carry shame or embarrassment around this one very normal, very human topic, touching themselves. Down there. But here's the truth. Your body hasn't expired just because you've turned 60, 70, or 80. In fact, there are surprising health reasons why you shouldn't give this up. So, stay with me right to the end, because this might just change how you see yourself and how you treat yourself. And while you're here, please like this video, subscribe, and comment below. Do you think women talk enough about this or not nearly enough? I'd love to hear your thoughts. Part 1. Your body still needs physical attention, even without a partner. Let's start here, because this is often the biggest misunderstanding I see among older women. For decades, society has quietly, or not so quietly, pushed the idea that once you reach a certain age, your body's needs somehow fade away. That sensuality, touch, pleasure, those are things for the young. What absolute nonsense. Your body might have changed. Your skin may not be as firm. Your hair may not be the color it once was. And yes, things may not work in quite the same way they did at 25. But here's something I want you to hear loud and clear from a doctor who's been working with women for over 30 years. Your body still craves attention, care, and stimulation. When I speak to my patients, women in their 60s, 70s, even 80s, I often ask, when was the last time you touched yourself without judgment, with the sole purpose of exploring or comforting your body? The room goes quiet, not because they don't want to, not because they think it's wrong, but because somewhere along the way, they were convinced that this no longer matters. But it does matter. Your skin, your muscles, your nerves, they are still very much alive. The nerve endings that brought you pleasure at 20 are still there. They may respond differently. They may need a bit more encouragement, but they have not retired simply because you have. This isn't about having a partner. This isn't about rekindling romance. This is about your relationship with yourself. Your body still thrives on gentle, intentional touch. In fact, the older we get, the more important this becomes to maintain health and connection with our bodies. Part 2. It's actually good for your health. Here's why. I want to pause for a moment here because this is where many women lean in, surprised. They say, "Doctor, you're telling me that playing with myself is good for my health?" Yes, that's exactly what I'm telling you. And it's not just my opinion. This is backed by medical science. Let's look at what happens when you stimulate your body, even in ways as simple as a gentle touch or a moment of private exploration. White heavy checkmark blood flow improves. When you touch yourself, you increase circulation to your pelvic area. This isn't just about arousal. This is about keeping tissues healthy, oxygenated, and strong. Poor circulation is one of the key reasons why many older women experience discomfort, dryness, and even urinary issues. White heavy checkmark pelvic floor health. Did you know that arousal and orgasm engage your pelvic floor muscles? These are the very same muscles that help with bladder control and support your organs. Keeping them active can reduce the risk of incontinence and other common age-related issues. White heavy checkmark hormone release. You may have heard of oxytocin, the so-called love hormone. It's released during intimacy, but also during self-pleasure. Oxytocin promotes feelings of calm, reduces anxiety, and can help improve sleep. Not to mention dopamine, your brain's natural reward chemical, which lifts mood and combats feelings of loneliness. White heavy checkmark stress relief. Touching yourself in this way isn't just physical. It's emotional. It reminds your brain and body that you are alive, connected, and deserving of pleasure, even when the world around you says otherwise. So yes, from a purely medical standpoint, this small act of self-kindness has enormous ripple effects for your health. Part 3. No, you're not too old for pleasure. This might be the most heartbreaking myth I hear. That part of my life is over. Or worse, I shouldn't be thinking about that at my age. Let me ask you something. Do you think men are told this? Do you think they turn 70, look in the mirror, and say, well, no more pleasure for me? Of course not. And neither should you. Pleasure is not about age. It's about connection. It's about recognizing that your body is still yours. It didn't stop deserving joy or comfort simply because you collected a few more candles on the birthday cake. I've had patients in their 80s rediscover themselves after decades of silence. They tell me how they felt silly at first, ashamed even, because no one had ever given them permission to think of pleasure as a lifelong right. But once they allowed themselves to explore, to reconnect with their bodies without shame, they found something beautiful, a sense of ownership, confidence, and joy that no one could take away. You are not too old for this. You are not too wrinkled, too saggy, too tired. You are alive. And as long as you are alive, your body is worthy of kindness, curiosity, and yes, pleasure. Part 4. Addressing dryness, sensitivity, and discomfort. You're not alone. Now, let's be practical. I'm not here to pretend that aging doesn't bring challenges. Yes, your body changes. Yes, things may feel different, sometimes frustratingly so. Dryness is incredibly common in postmenopausal women. Sensitivity can diminish. Even the fear of discomfort can stop you before you start. I've had women tell me, I just don't feel like I used to. It's discouraging. Here's what I want you to know. You are not alone, and there are solutions. First and foremost, lubrication. Forget the stigma. Lubricants are your friend. They make things smoother, gentler, and more comfortable. There's no prize for doing things the hard way. Second, tools. Many women find that vibrators or specialized devices help them reconnect with sensations that fingertips alone may no longer easily trigger. These aren't toys for the young. They are tools for health, for reconnection, for discovery. Third, talk to your doctor. If you're experiencing pain, there may be underlying causes from thinning tissues to infections to hormonal shifts. These are treatable. You don't have to suffer in silence or accept discomfort as your new normal. And please don't compare yourself to your younger self. You are in a new season now, a wiser, more patient, more compassionate season. Approaching your body with curiosity instead of expectation makes all the difference. Pleasure should never come with pain. If it does, it's a signal for help, not a sign to give up. Part 5. The emotional benefits older women overlook. Now, let's talk about something even more important than physical health, your emotional well-being. Because while the physical benefits of self-touch are undeniable, it's often the emotional rewards that surprise older women the most. When I sit with women in my clinic, they often confess, "Doctor, I feel invisible these days." Not just to men, but even to myself. Can you relate to that? That creeping sense that as your body changes, as your roles shift, from mother to grandmother, from wife to widow, from caretaker to someone needing care, it's as though pieces of your identity quietly slip away. Here's the truth. Your relationship with your own body doesn't end because others stop noticing it. In fact, it becomes more important than ever. Self-touch is not just about physical satisfaction. It's about reclaiming ownership of your body. It's about reminding yourself that this vessel, with all its wrinkles, its soft places, its scars, still belongs to you. It's about practicing tenderness, acceptance, and self-love in the most literal way possible. Many older women are surprised to find that through regular moments of intimate self-care, they start to rebuild lost confidence. They begin to look in the mirror and soften their harsh inner dialogue. They carry themselves with a quiet dignity, knowing they are still deserving of pleasure, comfort, and kindness. This practice can improve White heavy checkmark body image. You stop seeing your body as something broken or past its prime and start viewing it as something worthy of respect. White heavy checkmark confidence. You feel more secure, more alive, more connected to yourself. White heavy checkmark femininity. You reconnect with the sensual, soft, playful parts of yourself that society told you to pack away. White heavy checkmark mental health. Stress decreases, joy increases, and you begin to feel a spark that isn't dependent on anyone else's approval. Think of it as part of your self-care routine, no different than moisturizing your skin or moving your body, except this care goes deeper. It reminds you, I'm still here. I still matter. I still deserve to feel good. Part 6. How to start or restart without shame. I understand fully that for many of you, this conversation is uncomfortable. You might be watching this and thinking, Doctor, it's been years. I wouldn't even know where to begin. Or, I was raised to believe this was shameful. I've never felt comfortable with it. And you know what? That's completely okay. You're not alone. Generations of women were taught that this part of life, this need for touch, for pleasure, was either shameful or irrelevant after a certain age. But here's the wonderful thing. It's never too late to start learning how to connect with yourself in a new, healthy, and positive way. If it's been a long time, or if you're starting fresh, here's what I often suggest to my patients. Start small. This isn't about rushing to achieve anything. Begin with touch that isn't even sexual. Place your hand on your belly, your thighs, your chest. Reconnect with the feeling of your skin, your warmth, your presence. Set the mood for yourself. Light a candle. Play soft music. Create an environment where you feel relaxed and undistracted. This is your time. It's not selfish. It's necessary. Release expectations. Don't expect fireworks. Don't expect your body to respond as it did decades ago. You're in a different season of life. Slower, wiser, more deliberate. Let yourself be curious. Let yourself explore. This is about connection, not performance. Use tools to support you. Lubricants, massagers, vibrators, these are not shameful. They're resources. They're aids for health, not props for youth. Many women find that these tools help them discover new sensations and restore confidence. And above all, remind yourself this simple truth. There is no right way to explore your body. There's only your way, and whatever brings you comfort, peace, or joy is worth celebrating. You are not doing something wrong by reconnecting with yourself. You are doing something profoundly right. Part 7. What I tell my own patients. Let me share something personal with you, something from the heart. When women my age come into my office, they often sit across from me, their voices lowered, their words hesitant, as if confessing a crime. They ask, is it really okay at my age? Is this normal? Should I stop? And every time, I look them in the eye and tell them this. Not only is it okay, it's good for you. It's encouraged. It's healing. You don't need permission from your husband, your children, your friends, or even me. But if hearing it from a doctor helps, then let me say it plainly. You are allowed to enjoy your body at any age, in any way that feels right to you. We spend so much of our lives taking care of others, shrinking ourselves, silencing our needs to keep the peace. But the happiest older women I know, they've stopped apologizing for who they are. They've stopped caring what others think. They've started caring about what they think, what they want, how they feel. Self-touch is not frivolous. It's not shameful. It's not beneath you. It's a small radical act of saying, I am still here. I am still worthy. I am still mine. And that, my dear, is something every woman deserves to believe.